Our next speaker is Dr. Navneet TOSHNIWAL.
Dr. Navneet TOSHNIWAL is the next speaker. Excellent phaco surgeon from Solapur. Secondly, excellent teacher. He had two books on his name. And if you see the phaco, what he tips of the phaco, and you just see him, because that is practically what are the problems arise, he will share with you. Navneet, go ahead.
Thank you, sir. Thank you, Lane sir, who is my guru. Thank you, Ragini madam, for having me in this course. It's a video. Already, sir has covered the Morgangian, but what I am going to tell you, the white cataract tips and tricks. Every white cataract is a different. Stop and chop to start with. What Ragini madam has shown, that in a soft cataract also you have to start with stop and chop. So you have divided the nucleus with the phaco tip and chopper, and you can see the simple vertical chops in the back, because this is an adequate hard nucleus, and what sir has emphasized, the go into the nucleus and then chopping is very easy. One piece is over, second piece will move nicely, give a good position, embed the mask perfectly, and you can see the simple vertical chop in the back because of the adequate hardness. And the last pieces, you have to go in a supracapsular plane. This is another case. When you start with any white cataract, don't be overconfident. Every case is different. You don't know what is exactly the hardness and all that. You can presume, but reality when you start. That is the reason I start with stop and chop. It's a wide groove. This is the TOSHNIWAL pre-chopper. You divide it equal pressure on a two half of the nucleus, so there will be the less zonular stretch. And then every half we have to lift at the plane of the capsule. So now these are the horizontal chops. If you try to do in the back may be weak because it is a white cataract. You don't know the degeneration of the capsule. So at the plane of the iris or at the plane of the capsule, you can do this horizontal chop. Another piece automatically, when the space is there, with the vacuum and flow rate, piece will come towards you. No need to move toward the piece and the remaining chops. When you do these cases, as sir has emphasized, the viscoelastic, they are the must. Very important. Take a break and put it. This was a small pupil, shallow SC and mature cataract. So I was not interested to put dilatation before on table. I have put the dilatation. Very important products are in the market. And then I started with the capsular axis. Sir has mentioned many tips. So this is a very important. Use directly. I am using the forceps. This is the microcapsular axis forceps. Do it in a small, but you have to see the edges. If edges are not curvilinear, you have to check, and even this small edge you have to remove with the forceps and then aspirate, so the intra back pressure will be reduced and you can do. This is a micro scissor, again a micro axis forceps. So what is the important thing when you want to tackle these cataracts, because these are the experienced surgeon, but for us we have to take the good instruments. So micro axis forceps, micro scissor, they will help for these cataracts. Again the same thing, stop and chop technique. Hardness you will understand in a 1 or 2 stroke. This I have mentioned in my first book. You should feel the trench so that you will get the correct idea of the hardness of the nucleus. This is again a pre-chopper, equal pressure, put in the center, go in the deep in the groove. These instruments are now the part and parcel of our phaco surgery. And again, when you confirmation of the division is the very important. See, it is stuck at one point and chopper is there to help you. Engage the piece and complete the division. So division, just division is not important. Confirmation of the division, then the rest of the things are easy. And if you see here, I don't use chopper more. It is the one phaco handpiece in the center or just near. Here you can see, just dislodge the piece, But again, go with the certain principle. Don't push the piece directly from the convex end towards the center. That is many times what we are doing. Go to give the correct position to the piece, whatever it may be, half hemisphere or anything, and again bring at the level of axis. Another very important point in this situation, that piece should not be stay vertical. Keep it horizontal with your phaco tip only. Now here I started the capsular axis. Suddenly it went away. I catch, I completed, but I see another tag and I tried to complete it. This is what already I mentioned. So these instruments are very, very important. Decrease the intra-back pressure. When you are talking about the tips and tricks in a white cataract, most important is the capsular axis. Because unless and until we do the complete capsular axis, we cannot move. These are the very, very simple instruments and not very costly, but one has to do the practice. Why I am telling you, with the needle, you have to push the capsule. With this forceps, you have to pull the capsule. So this push and pull is important. So pull technique is very important. What the sir has mentioned rightly, that no ego. This was my video of 6-7 years before. I was not having the very good knowledge of the depth of the trench. I could not divide it. In those days, immediately, and this is the learning from my father, don't do overconfidently anything. So I trying to convert it a very simple way, just extend, because I am doing my all the cases till today limbal incision. So very easy to convert. I don't do the clear corneal. So it is very easy for me to convert the case. Here you have to take precaution. This small size of capsular axis is not needed. You have to cut it. So most important is your incision part, crescent, keratometry, and in those days I was using this our Vanna scissor to cut the capsule at the 2 proper point and maybe 1 inferior. As many as points, no problem, according to the hardness of the nucleus, and just lift it out. I never see what is the size of the incision and all that. It should come out smoothly without damaging to the PC or cornea. So nucleus is out, you can remove it, and then I saw that posterior capsule. You can see here the posterior capsule when I was touching with the visco cannula, it was so fragile, so that was a great decision, otherwise nucleus might have gone into the vitreous. So no ego for these cases. You should be ready with the many tools, but finally you can be ready to convert these cases. This is a simple 3-piece PMMA lens for this purpose. So finally, white cataracts are different. Many tips are there, tricks are there. You have to go accordingly. Thank you very much for your patience hearing. Thank you, Ragini madam.
Wonderful presentation, Dr. Navneet, sir. Sir, one question to you. You have, do you the same chopper for everything, or do you have some different choppers for different cases as far as hardness of nucleus is concerned?
You mean to say pre-chopper?
No, chopper.
Chopper I am using, very good question, sir. This is all the time confusion. When there is a hard cataract, you should use sharp, long. Everything is correct. But believe me, in chopping, hold is most important. If you hold perfectly, any chopper, any simple chopper will chop, sir. In all the grades of cataract, this is my perception. Thank you.
Thank you, sir. Because these are all horizontal chopping techniques, and you have, chopped it very nicely with even with the blunt chopper.
Yes, thank you, sir.